Almost everyone knows someone who's been affected by Alzheimer's disease, but have you ever wondered what actually causes memories to disappear? By the end of this video, you'll know exactly why Alzheimer's happens, why people with Down syndrome are at a higher risk, and why students always confuse amyloid with tau. So let's get into it. Alzheimer's is the most common cause of dementia in older adults. So what does that mean? It means that increased age or advanced age is one of the strongest risk factors. One high yield fact for step one is that individuals with Down syndrome are at an increased risk. Why? Because Down syndrome means you have an extra copy of chromosome 21. Now, chromosome 21 has this gene called amyloid precursor protein gene. And if you have more copies of this chromosome, you're going to express more amyloid precursor proteins, which means more amyloid is produced, hence increasing the risk of Alzheimer's at a much younger age. So what actually causes the Alzheimer's? Well, now you know. It's the amyloid-beta from the abnormal processing of amyloid precursor protein, right? These proteins, amyloid betas, they are misfolded, they are sticky, and they begin accumulating outside the neurons, forming what are known as amyloid plaques. We'll get to that in a bit. There are also important genetic associations. We've got sporadic and we've got familial. Now, for sporadic, you've got two alleles that you need to know. You've got ApoE4, you've got ApoE2. And all you have to know is that ApoE4 puts you at an increased risk, so you're technically 4 times at risk. That's a quick way of remembering it. And ApoE2 is protective, and I like to remember protective. You know, it sounds like protective. 2 is protective, 4 means there are more, so you are more at risk. Now, there's also the familial form. I'm not really going to get into that. You just need to know Presenilin 1 and Presenilin 2. These are the mutations in APP that are associated with increased amyloid beta production, right, which are associated with increased Alzheimer's disease. Now, let's look quickly at what happens in the brain. On gross pathology, you see what we call cortical atrophy, right? So on the left side, this is what a normal brain looks like. Look at how healthy and big and nice it is, right? This is courtesy to Smart Medical Arts. It's full. It appears healthy, right? And on the right side, this is a brain with Alzheimer's. The cortex is atrophied, the sulci are wider, and the gyri are narrower. The ventricle also looks noticeably bigger. Now, someone can confuse you guys, this is the important part, right? They're going to ask you, is this hydrocephalus? And you're going to say, no, this is not hydrocephalus. This is something else. It's called Hydrocephalus ex vacuo. What does that mean? It means that the ventricles appear larger, not because there is increased cerebrospinal fluid, but rather because the brain tissue around is being absolutely destroyed. So the ventricles look like they're bigger. They're not enlarging though. Let's get to the next part, microscopy. Alzheimer's disease is characterized by 2 classic findings. It matters whether you are talking about whether it's extracellular amyloid plaques or whether it's intracellular. So extracellular, it looks like this. These are called the amyloid plaques, okay? Also known as senile plaques. So that's another name for them, senile plaques. Intracellularly, though, these are called neurofibrillary tangles, okay? This is what it is. And what this is, it's made of hyperphosphorylated tau protein. So anytime, a simple way to remember this is by saying that amyloid plaques are outside the neuron. And then you say tau tangles are inside. All right. So it's important to know that the number of neurofibrillary tangles correlates with the severity of the dementia. Okay, and that is Alzheimer's disease in a nutshell.